Remember this date, November 2009, the death of healthcare. Why do I say that? Well, first of all, the system they came up with, written by lawyers, for lawyers, has not addressed two of the biggest issues, tort reform. $300 billion is what doctors and hospitals pay into a fund. Only 18% gets to the patient. Guess where the rest of the money goes to? Lawyers. So if you think tort reform isn't important, you could save probably $200 billion right there. Let's talk about drug companies. Drug companies, they're entitled to make a profit, but they're raising all their drugs by 9%. Why? Because down the road, they're going to get back 6%. So they made 3% more probably. They'll get back 6%, and they'll tell you, we gave back money because we want to help the government save healthcare. You know that's not true. Some of these drug companies' profit are really excessive. There's a diaper rash ointment. It's Monistat diluted with zinc oxide. You can buy it over the counter. The dilution comes down to about $1. Guess what they charge for this little item that's worth no more than $1? $191. A diaper rash ointment. That's just typical. Yes, the cost of making drugs is expensive, but it's usually NIH grants going to universities that develop most of the drugs anyway. There's a book, The Truth About Drug Companies, written by the former editor of the New England Journal of Medicine. If you read that book, you won't be able to sleep thinking that these drug companies, all they're out for is to make money. They make some terrific products, but the pricing is insane. I want to change a little bit with drug companies. Here's the first thing I want to change. I want to give them unlimited 5-year run. Charge whatever you want. The next 5 years, license it out to 2 other manufacturers in the drug industry. Let them get 10% of the gross sales. After 10 years, license it out to every company that wants to get it, and they make 10% of the gross sales. For whatever that time period is fair, 10, 20, 30 years, I don't care, but at least create some competition. That would address 2 issues that are not even the healthcare. The next thing is, who wants to be a doctor? You got to go and borrow $250,000 to become a physician. You can't pay it back. You're not making enough money. There are bankruptcies happening today to physicians. Yes, physicians are going bankrupt. Doctors do not make what people think they make. If we want to address the uninsured, and that's what it got started with, a simple solution. Give a person who needs to pay back a loan, that could be a physician who just got out of medical school, or he's buying vaccines, which cost over $1 million to vaccinate 1,000 kids. Maybe he wants to get his credit card bills down because he's been using his credit card to pay for his outrageous immunization bills. Give him a $50 reduction in those bills. No income to him. This way he can afford to buy vaccines or pay maybe his tuition bills back. Then maybe some more people will go into healthcare. And the uninsured get covered. Say they work 2 days a week in a clinic. They see 30 patients, both times 60, times 50. That's $3,000. They'll pay back their loan. They would be overjoyed to find a way to pay back the loan. Let's think about what you're doing with this new bill. This new bill is going to destroy 1/6 of the American economy. Go look at some cities. Boston. Those hospitals are filled with Canadian and European patients. Why do they go to Boston? Is the healthcare in Canada great? The healthcare in Europe great? You think that out a little bit. So before we destroy what we got, let's find ways to fix what we got and slowly incorporate a new type of healthcare. Yes, we need a fix, but I don't think a lawyer, congressman and senator know how to fix healthcare. They know how to fix their part of the world, which is law. They haven't done anything about fixing the cost of malpractice, have they?